So here we're going to focus on epistaxis. Epistaxis, it is called nose bleeding. Or easy way, what is epistaxis? It is nose bleed. There are some risk factor related or causes the epistaxis. What are the risk factor? Basically, the trauma, patient give a history of trauma or low humidity or any underlying disease can cause epistaxis, like hemophilia, leukemia, or certain medication also can cause nosebleed. Let me read it. The nose, especially the septa. So this is the nose, the partition divided the two nostrils we call septum or septa. It is highly vascularized. So this area is highly vascularized. And also the bleeding usually result from direct trauma or foreign bodies, nose picking, or mucosal inflammation. Recurrent epistaxis and severe bleeding may indicate underlying disease like leukemia or cancer, hemophilia means blood clotting deficiency, or certain medication. If our patient have a epistaxis, what is nursing care? Right? The first priority is to stop the bleeding. If bleeding cannot control, also packing or cauterization of the bleeding vessel may be prescribed. So we tell our patient, sit the patient up, or whole head is just lean forward, and also this position to prevent the aspiration of blood. We apply the pressure to the lower nose with thumb and finger, like this picture. We tell your patient to breathe through the mouth until bleeding stops. Also, pack the cotton or tissue into the side of the nose bleeding. Sometimes we apply the ice across the bridge of the nose. That can help to stop the bleeding. So let me talk about this picture here. Keep in mind, nosebleed are common, but can occasionally or sometime it is more serious medical problem. So if we see the patient, or if you have a nosebleed, what we could do? What are the step-by-step process? In this picture, we have wrote 3 steps we called first aid here. First of all, hold your nostril close with your thumb and index finger, the picture number 1, and lean your head forward. Ensure your head is above your heart by sitting or standing position. then be relaxed. Imagine after the step-by-step process, if your bleeding does not stop or if bleeding is continue, what we will do. So we should look for medical attention if you have nosebleed more than 4 times a week, or if you have more symptom with your nosebleed. Nosebleed with some other silent symptom, we always go to for medical attention or we go for emergency department. Keep note, your nosebleed after the, like picture number 1, you pressure in the bleeding side. If after the 15 minute, if your bleeding still going on after 15 minutes, despite following this procedure means 1, 2, 3 procedure, what I explained. And if we see nosebleed with other silent symptom like high fever, like nosebleed with coughing up or vomiting blood, or if you feel like fainting, tired, weak, or if you have a skin rash or have an irregular heartbeat, we always talk to the healthcare provider. It is, in that scenario, it is medical emergencies. But here we must know what are the nursing care for nose bleeding. Okay, and most priority, we could stop the bleeding first. Tell your patient, sit the patient up and tilt head forward to prevent the aspiration of blood. Then we apply pressure to the lower nose with thumb and finger. At the same time, tell your patient, continue breathing through the mouth until bleeding stops. Sometimes we pressure over the hair or pack the cotton or tissue into the side of the nose to stop bleeding. And sometimes we apply the ice across the bridge of the nose.